They're scattered throughout hospitals and medical offices.
Our residents see patients both in our clinic as well as in the inpatient setting in the hospital. They have an attending who works with them, who sort of oversees that care.
Resident physicians have already completed 4 years of medical school but need hands-on training focusing on their medical specialty.
All doctors have to go through a residency program, and it's a unique opportunity for them to be mentored and to be to sort of go through apprenticeship in their specialty.
Supervised by faculty physicians, residents are required to complete medical training as part of their education.
They are very capable physicians. I, as a supervising faculty physician, learn a lot from the residents, and I think that's one of the things that I love most about practicing and teaching in this environment.
In partnership with Florida State University, Lee Health offers a family medicine residency program to graduating medical students, attracting new doctors across the country.
So the kind of care that they offer, even though, of course, they're in training, is exceptional care because, number one, they're the cutting edge of what's happening and what's new. But it's also going through several minds where different people are distilling and discussing and deciding that whether this is the best care for this particular patient.
Collaborating with other residents and working under the supervision of senior physicians, the program offers new doctors the opportunity to receive training.
For many of our patients who have very complex medical and social situations, to have that level of oversight of all aspects of their care is really unique.
A program geared towards the education and care of both patients and physicians. For Lee Health, I'm LINDSEY Morton.